Thank you, thank you. So, we're going to start with our fifth initiative, Student Health Hub, a school-based health network for improving youth behavioral health outcomes, presented by, and I did these phonetically, Devyna Aguon, Delaney Knottnerus, and Adam Davis I can get. Devyna Aguon is a mental health facilitator with the Renton School District, where she manages the Student Health Hub and coordinates grant implementation for the district's school-based screening, brief intervention, and referral to supports program. With over 14 years of experience in education as a mental health social worker and school counselor, Devyna is dedicated to supporting the well-being of children, youth, and their families through accessible, school-based mental health services. We have Delaney Knottnerus, is a social worker and substance use disorder professional at King County's Department of Human Services, where she co-manages the school-based screening, brief intervention, and referral to program. This innovative initiative uses a digital tool to assess student well-being, including mental health, substance use, strengths, goals, and experiences both at school and at home. With 9 years of experience working with children, youth, and families in the Seattle area, Delaney is passionate about supporting the community's mental health needs. A proud Washingtonian, she's a double dog, earning both her bachelor's and master's degrees here at the University of Washington. Adam Davis is a family and psychiatric nurse practitioner and co-founder of the Health Commons Project, a Washington-based nonprofit that unites schools, hospitals, fire departments, and community organizations to form coordinated health networks. Since 2022, he has led the development of the Student Health Hub, a statewide initiative focused on improving youth behavioral health outcomes. Currently, Adam is guiding efforts to scale the program across Washington and integrate new technology solutions following Health Commons Project's acquisition of One Healthport, the state's health information exchange. Cannot wait to hear.
Thank you, Bert. Good afternoon, everyone. It's really an honor to be here today. Thanks to the University of Washington, and thank you to the Chad's Legacy Project, Todd and Laura. It's a real honor for us to be able to share this work with you today. So as Bert said, my name's Adam Davis. We're a community-based nonprofit called HCP One Healthport now that we've acquired the state's health information exchange. And our role in this work is really as a community helper. So for the last 3 years, we've just been working with an incredible team of people and organizations to develop this program that's called Student Health Hub. And this is a collaborative effort to ensure that all kids and families in Washington state can easily access the services and the support that they need to thrive. Now, it's not lost on me today that we're talking about the Student Health Hub and we're actually sitting here in the UW Hub, a physical space which I don't know if you've walked around this building is absolutely incredible. I mean, they have everything a college kid could want or need. They've got food, they've got banking services, they've got a bike shop, they've got student activities, peer support, they've got tutoring, and they even have a bowling alley down in the basement. So picture this hub that you're sitting in. This is the physical environment. What we're working on is creating sort of that virtual connectivity between different services in a community that support kids and families, and making sure that kids and families can access those services through their school, a front door. So I'm super excited to be joined on stage today by two of my colleagues, Devyna Aguon and Delaney Knottnerus. As Bert said, Devyna is really focused on implementation of the hub in Renton, which was our first site in Washington state. And Delaney leads the SBIRT program, which really underpins this work. That's the evidence-based care model that we built the hub around. So the hub model really does not exist without these partners here on stage with me, and in fact, many of the partners that we have in the room here today. And so we just wanted to take a moment to ask those organizations that have been part of this work to stand and be recognized. So those are schools, providers, financial supporters, members of my team. If you could just take a minute and stand and be recognized. We call this really the ultimate team sport. It's a big collaborative connected effort, which I think Laura was talking about earlier today. All right, brief preview of what you're going to hear over the next several minutes. So number one, you're going to hear that the hub is up and running in Renton and now Seattle, our second site. Number two, you're going to hear that we are preparing to expand this work to new schools, new providers in communities across Washington state. And then number three, to scale and sustain this work, we are going to need your help. And that's why, Todd invited us here today, because that really is our call to action. The work is gaining momentum, but we're gonna need a lot of helpers to get where we wanna go. So with that, I'm going to hand it over to Devyna to talk more about the Renton Hub.
Thank you, Adam. Good afternoon, everyone. We're going to start off with a short video that was produced by the City of Renton to introduce you to the Hub.
Last year, we expanded our approach to social services. We had provided services to those who were in crisis only and need, which is still extremely important. It's a social safety net that we want to continue to provide. But what we wanted to do, and at the direction of the mayor, was we wanted to invest upstream. We wanted to invest in our youth. And so to ensure that, we needed some sort of connection with those students, and that was through the Renton Health Hub and working with Health Commons.
The Student Health Hub is a strategy that seeks to remove barriers that our students and families often encounter when they're seeking out behavioral and mental health support. And the big thing for us is that we don't believe that anyone's access to these resources and support should be dependent on who they know. So whether that's who the student knows, who the family knows, or who the school counselor knows.
You can get a referral for an agency, a community mental health agency, and it will basically assess what your needs might be.
Having the student and family prepared that this agency is going to call you really helps services get started faster. There's not as much back and forth.
And this work is focused on doing school-based screening and providing brief intervention to students in school settings.
We are able to provide behavioral health support, such as individual counseling, family counseling, substance abuse, and so it just really leads to a pool of networks that families can really connect with.
My involvement with the Student Hub was created by this kind of synergy between public health and the Research Institute, as well as the City of Renton. Student mental health issues is actually the #1 predictor of school dropout. And so students who have mental health issues really face increased odds of a lot of negative outcomes later in life.
I think that there's been a lot of changes over time, and with the pandemic, we're seeing a lot more anxiety. A lot of our students are dealing with grief and loss, and also just wanting to improve academics and peer relationships.
All HIPAA and FERPA requirements are followed.
So these social service organizations are careful on what they give us, but they do verify how many Renton residents are served and how many service units is the city's general fund going towards. What we're looking for is what can we adapt by way of parks and recreational programming. We do want to make sure we're funding those organizations, again, to ensure access and resource, but we're looking to figure out how we can also, down the road, adapt our other operations and programs to continue to provide holistic and well-rounded support for students.
It could be cultural needs, it could be language needs. Wherever the student and their family are at, we want to meet them there and help them to get the supports that they deserve, quite frankly.
The more we can impact and address these problems early on, we can help youth stay in school, have better lives, and kind of build toward the future.
I think that it's a good program, and I think that most of the school districts in the state should be adopting this.
It's the reason why I think it's special to live in Renton, is that when there are issues or challenges, we come together and we set aside our egos and we do good work for the people who we serve, and in this case, our students and families.
Now I'd like to talk to you more about why we started this work. As many of you know, our kids are struggling. As a school social worker working in Renton schools, we've seen a steady rise in depression, anxiety, self-harm, suicide, substance use, and violence, trends that only worsened during the pandemic. Let me give you a few examples of what we see in our schools. A 9th grader who is a sexual abuse victim was hospitalized multiple times due to suicide attempts. A 7th grader avoids school due to trauma and anxiety, and also their parents' substance use. A 4th grader struggles with grief and loss due to the death of their grandmother, who is their primary caregiver. None of this is surprising for those of us doing this work. And yet, there's no simple fix. Schools can't do this alone. Neither can clinics or crisis lines. We're asking exhausted systems and overwhelmed staff to respond to complex problems that were never meant to be tackled in isolation. That's why, as a community, we came together and decided it's time to think differently. The solution we developed and implemented is called the Student Health Hub. It's not another spreadsheet or referral form. It's an integrated system that ensures students are screened and matched to the right services. School staff and community providers can coordinate care, and funders get the data they need to invest wisely. So here's how the hub works. Students are identified for support in 2 ways. Proactively, a universal classroom-based screening, and through individual referrals by school staff who notice students who might be struggling. From there, a school counselor follows up with the student. If needed, they collect consent from the caregiver and refer to the hub. Then the hub matches the student to the most appropriate provider based on needs, insurance, culture, language, and provider availability. The receiving organization then confirms receipt of the referral, engages the student in services, and sends status updates to the school counselor to close the loop of the referral. So let me give you an example of a real student experience. A 7th grader was screened. The school counselor met with her to follow up, contacted her caregiver, made a referral for mental health services due to concerns of self-harm, substance use, and her recent parents' divorce. The student was matched for services the same week. An intake was scheduled for 2 weeks later. The student has continued to engage in services for the last couple of months. This situation is an example of why the hub matters. It's not about making more referrals. It's about getting the right help to the right students at the right time. And the data shows, as you can see here, the approach is working. We built the hub in a step-by-step way that any district can replicate. We started off by partnering with UW Smart Center to help us assess our district's strengths and needs. From there, we partnered with King County and Seattle Children's to implement SB Expert, an evidence-based model for screening, brief intervention, and referral to supports. Then, we partnered with HCP, One Healthport, to build the hub infrastructure with our community providers. To do this work, we did this by braiding funding from city, county, state, and philanthropy. And now we're evolving toward a whole child model, connecting kids not just clinical care, but food, housing, recreation, mentorship, and more. The vision is big, but it's possible if we work across systems and sectors to center what kids truly need. That's why we're really excited to partner with King County, who shares the vision and is already working to bring this solution to scale. I'd like to hand it over to my colleague, Delaney Knottnerus at King County, to share what this could look like across the region.
What you just heard from our partners in Renton is really powerful. A scalable, community-driven model, proof that schools really are the hub for whole child supports. At King County, we see this success as a blueprint for a collaborative effort to make sure that every district can access the full spectrum of support that they really need for their students to thrive. That's why our next chapter focuses on these two things. Number one, continuing to enhance the school-based SBIRT model with whole child supports that go beyond just clinical care, addressing the full range of factors that shape health, learning, and lifelong success. And then number two, supporting school districts, city governments, and their provider partners who want to replicate this model and do this really important work. I'm gonna hand it back to Adam. Thank you.
Thank you, Devyna and Delaney. As you've heard from our community partners, we've got a really strong vision of where we want to go, and we've got a great foundation beneath us, an incredible group of partners, and momentum is starting to build around this work. Just last week, we learned from Washington State that over the next 8 years, they're planning to invest $92 million in community information exchange. This is the type of infrastructure that fits in nicely with where we want to go with the hub. So now's the time to come together, work together across sectors and across organizations to build a connected and equitable system that our kids and families really deserve. So if you're a school leader or a provider in the community, come talk to us about joining the network. If you're a city government, state government, county government agency, a philanthropy, corporate sponsor, come talk to us about how we can co-invest together to support this infrastructure and make it scalable and sustainable. Our team is both available on AirMeet or studenthealthhub.org or healthcommonsproject.org. So we'd love to chat with you if you're interested in joining this movement. And now we'll open it up for questions. Thanks.
Oh gosh, hot on the mic. I'm so excited about this. I've met with Devyna, and I'm meeting with Health Commons on Thursday. I represent a national provider, Charlie Health, that has a really strong presence in the Washington community. We've been providing services here for almost 5 years now. So I love scalable, innovative ways to meet the mental health needs across the state. I love thinking about this being replicated across the state because there's such a need. I would love to hear the perspective of maybe how this gets replicated. Does the wheel have to get sort of reinvented in every district, or because you have sort of a roadmap created, do you get to kind of have a head start? But if you go to a rural community in central or eastern Washington, do they have to sort of, start over with resource creation, or when resources are more limited? And I noticed, some national partners that you guys will be working with and leveraging, but I would love to hear maybe the thought process of what it looks like to implement throughout the state.
Yeah, thank you, great question. I think the best example that we can point to about what's possible in terms of scaling this is something that we were part of during the pandemic, and Renton School District was a part of this program as well. It was called Learn to Return. So it was the state's school-based COVID testing program. And we worked with Department of Health and OSPI, the Office of Superintendent of Public Instruction, to implement that program in pretty much 98% of schools. So making sure that every public, private, and tribal school basically had access to COVID testing to help reopen the schools. So we're approaching this work in the very, similar manner, getting a couple of pilot communities that want to work together, figure out the nuts and bolts of how this system and infrastructure can be built. And then we bring sort of a manufacturing mindset. So over time, as we work out the kinks and simplify the product, in this case, the hub, we can offer it at a lower cost and an easier implementation for districts that might not be as well resourced as a Renton or Seattle. I will say, if COVID testing implementation in schools was a, 5 out of 10 on the complexity scale, this is more like a 10 out of 10. The issue is not so much the humans know what to do. The technology is sort of maybe the easiest part. The hardest part is figuring out how to braid the funding together. So that's why we're really excited to see the state sort of leaning into, investments in infrastructure, because that's what it's really going to take is putting investments in infrastructure and figuring out how to braid funds together to make a go at these sorts of systems. Hopefully that answers your question.
Hi. Over there. Here, I'll move. I am really interested in trying to figure out how we do true early intervention and prevention. Jürgen talked about bringing it back as early as possible to the 0 to 3 population, and the ESPER Check Yourself starts at maybe age 12. But my children's problems were in kindergarten, being sent to the principal's office the first day of school, and not being able to have the language skills to be able to navigate learning how to read, and being bullied because he couldn't stand up for himself. This was the other child. And I'm curious about how you see, do you have ideas about how do we help identify kids before they get to your stage? Because you guys are not early intervention and prevention. You are still addressing the crisis. Not to say that this isn't good. That's not my point.
No, thank you. That is a great question. And one of the things that is important to know is that SB Espert is just one of the many different screeners that we have, right, available in schools. And we do, for our elementary students, we do have different screeners that we look at to be able to identify what are the supports that our students need. One of the things that it's really great to be able to identify what those needs are, and it's not just looking at what the problems are, but also their strengths, right? Building on their strengths. What are some of the interests that they have? What are some of the activities? What are some of the goals? What are some of the things that they enjoy, right? So being able to identify those things through the screening, so we can look at what are our opportunities to reach our students before they get to a place where they're needing that intervention. So it's really a way to be able to proactively address what is it? How can we expand on those pro-social, proactive ways of reaching our students and making those connections early on. So I will say that, even though this is just happening in Renton and in Seattle, there are other school districts who are doing great work when it comes to screening.
I was going to say too that I think that was a fabulous question, and it really relates to what the panel before us was talking about, of really realistically it's all about connection. How can we connect with this young person? before we get to that point, right? And I think when we think about our program or the medical model in general, it's, identification based off of a thing that has happened, whether it's, truancy or academics or suspension or substance use or anxiety symptoms, et cetera. We're kind of also starting at this deficit-based model versus how can we start it being, hey, we see you as a whole child, a whole human, you're in our school building, what does this look like, how can we connect with you? So I would say that it's a culture change, it's a shift. It's all of us in this room thinking, okay, how do we do this a little bit differently, knowing that really at the heart of it, it is connecting with this young person and this family. So I just wanted to highlight that because I don't really know if our systems have been able to figure that out exactly, especially in schools. Not that I'm saying people aren't connecting to young people in schools, but it wasn't set up for this. And so how can we maybe try to do things differently?
Yeah, I would add that the focus on the individual when you're talking about elementary school students is perhaps the wrong focus. Yet building relationship with a child is good, but the primary caregiver, there was that example of that woman that was talking about how she was the case manager in the video and so overwhelmed. That was my journey, and there isn't trust that is developed with parents. The parents are not seen as part of the solution, and then we must move early intervention to the parents and not just see, that's the medical model, that the child is the problem or the person in the center. The family systems model looks at the whole family is part, and how that child lives within the family is important. And if you're not really seeing, especially early on, that parents are super important and looking at screening us, and building trust with us and relationship with us, it's not going to necessarily yield the results that we hope for. Thank you.
Hi, Marissa Ingalls with Coordinated Care. I've been in a lot of conversations around, community information exchange, health information exchange, whatever kind of information exchange you want to be talking about to create these closed-loop referral systems. And something that I've noticed in these conversations and in what you've presented is there's a lot of different stakeholders involved, and that brings a lot of different ideas about what the fundamental platform and how it's used should look like. But I am also thinking about those stakeholders who are not necessarily convinced that this technology solution is going to work for them. So can you talk about the process you all went through at the jurisdiction level you did, why that was important, and how you identified those groups that you moved forward with to build out the platform?
Yeah, thank you so much. Great question. I think we are unfortunately living in a moment in time where we've put technology on a pedestal and thought that it could really solve all of our problems. It's an important component, but we really take more of that Amazon mindset of how to build these systems, which is you start with who you're trying to serve, and then you figure out what service you want to deliver, and then you figure out what providers you need to deliver that services, and then you put in the technology and the funding. So that's the approach that we took with this work, as we've taken with our COVID testing work and other program areas. I think whether it's HIE or CIE or pick your IE, the important part really is not so much the technology itself, but it's making sure that we take this client-centered or student-centered approach, and that there's interoperable data formats. So making sure that we can exchange the data and that the formats are the same regardless of what tool or technology people use, that's super important. But the technology itself is almost of limited importance when making these decisions. There's great technologies out there. That's not the real issue. Hopefully that answers your question. Is that it? Yeah, I think that's it for us.
Thank you. Thank you so much. I always appreciate it when it's focused on students and young people.